I just got off of a week in the ICU, taking care of COVID patients. I think it's if you don't work in a hospital and you don't do what I do, I think it's kind of hard to imagine. But we have a ward of the hospital now that's actually one of our new awards that we are using as a COVID ICU. And it's happens to be a really long ward. Everybody's on the ward is in PPE, gowned up, masks on, and doors. All the rooms have been converted into negative pressure. So when you actually walk in the room, all you hear is the hum of a fan. Patients are on high flow oxygen if they're not ventilated, and they look really sick. These are some of the sickest patients that I've taken care of, and some of these patients year and a half ago that we are taking care of with high flow oxygen, I would have intubated and put on a ventilator, but we obviously can't do that. And we learned not to do that, and we've become more comfortable with that. But so when we do intubate patients, it is kind of the last resort. And right now we have about 19 of those. Almost every day at this point, we're having cardiac arrest from patients when their oxygen levels dip too low and we can't supply them with enough oxygen. Unfortunately, on the COVID units, we don't allow visitors. It's logistically is almost impossible. We only have family come in at the end of life, and that's a big change for us. Having that family support is, I think, important for patients, but it's also important for our staff, and to be able to communicate with families. We do a lot to do. We have to try to bridge that gap. We have iPads, and we call the patients' families on a regular basis, usually during rounds, and talk to them. Luckily, this time around, we don't have a PPE shortage as of yet. I keep worrying about that. So we're not having to reuse our masks as much, and gowns and things like that. So we're well supplied from that point. But it's much different to see these patients as sick as they are on a daily basis, and they're there for a while. And luckily, many of them get better, but it's not. It's unfortunately some of them don't. I think that the thing that's really changed for us has been seeing that younger patients are dying from this, and it's quite disturbing to see these patients declining, and they're what I would consider healthy. They're normal, everyday North Idaho people. They may have some comorbidity, such as hypertension, but honestly, we've had patients with really no significant past medical history who have died from this Delta variant. We also have many in the hospital now requiring high amounts of oxygen and or ventilation that didn't have any prior conditions.